Hi guys, today I wanted to talk about end-stage renal disease. End-stage renal disease, otherwise known as kidney failure, is a disease of the kidneys. The kidneys are two little bean-shaped organs located right under your rib cage. The kidneys filter your blood, remove waste and extra fluid. The kidneys regulate our blood pressure or blood sugar, balance our electrolyte levels, and balance our acidity, and secrete many essential hormones to our body. End-stage renal disease is when your kidneys reach a point where they no longer filter your blood at a survivable level. It's categorized in a couple stages. The final stage is called end-stage renal disease. Nearly 1 million people in the United States have end-stage renal disease, and it's life-threatening if left untreated. Symptoms include extreme fluid retention, which is swelling of the body from excess fluid, lethargy, weakness, high blood pressure, anemia, heart problems, nervous system problems, immune system problems, and other issues. Kidneys are the most sought after organ worldwide and are the most commonly trafficked organ in the black market. I'll now get into some of the causes of end-stage renal disease. The main cause of end-stage renal disease is uncontrolled diabetes. High blood sugar from diabetes damages blood vessels in our body. Damaged blood vessels in the kidneys cause impaired kidney function, which eventually can lead to end-stage renal disease. The second most common cause of end-stage renal disease is hypertension, also known as high blood pressure. High blood pressure damages our blood vessels, which also impairs blood flow to the kidneys, which in turn can lead to end-stage renal disease. Another cause for end-stage renal disease is drug toxicity. Kidneys filter medications out of our body. Over time, medications can wear down our kidneys if taken excessively. Some medications are more harmful than others. There are other causes of end-stage renal disease, but these are the three most common causes. There are three treatment options for people of end-stage renal disease. The first most common treatment option is hemodialysis. Patients will need to attend hemodialysis 3 to 4 times a week, and each appointment takes approximately 3 to 4 hours. Hemodialysis consists of two tubes being connected to the patient's body, usually in the chest or in the arms. One tube brings blood out of the body into the machine where it gets filtered. Then the other tube brings the blood from the machine back into the body. So, who's affected by end-stage renal disease? End-stage renal disease affects millions of people. Over 1 million people in the United States are diagnosed with end-stage renal disease. People of all ages are affected by end-stage renal disease, and they may have to be on dialysis for the rest of their life. African Americans are disproportionately affected by end-stage renal disease. End-stage renal disease affects people drastically, and it affects their family as well because they have to deal with the grief and worry that this disease brings. The other treatment option is peritoneal dialysis. Peritoneal dialysis is when a dialysis solution gets put into the patient's body, into their stomach through a catheter. This solution absorbs wastes and filters the body. This fluid is then drained out of the body into a bag where it is disposed of. This process has to be repeated multiple times a day and has to be done every day. Many people do it in their sleep using a machine that automatically does it. I chose this topic because I've been working as an EMT for the past 4 months now, and I have to pick people up and drop people off at dialysis, so I see firsthand how these machines work and how debilitated some of these people are. So it motivated me to go back to school and pursue a career in nursing and possibly become a dialysis nurse.